Next question, are the snap-on dentures more expensive than the fixed all-on-4 implants? No. I would think that the snap-on ones are good because I can clean them easily myself, but the nylon parts may become loose eventually. And all the implants are so costly and so invasive, sometimes I feel that if I were to remove all my teeth due to severe bone loss from past gum disease, I would rather just end up with complete dentures. Okay, but just to answer that question, yeah, absolutely they are cheaper, and conceptually it sounds nicer because you could take it off and clean it, but realistically speaking, these are snapped in versus a fixed prosthesis, which is screwed in. So I can only tell you, obviously I have my teeth, but I can only tell you what countless patients over 14 years have told me, and also many other dentists. All dentists will tell you that something that's fixed, like an all-on-4 or an FP1 bridge, whatever you have in your mouth, it's screwed in, is gonna feel way more natural, like real teeth, than a snap-on denture ever could. All right, so someone said, let's see here. We had a video about how long can all-on-4 dental implants last, advice for young people, young patients, and she said she's saying practically all that she wants is a set that will last her 50 years. I literally just had a virtual consult with a patient from down in Houston, and you know, we warranty our product for 10 years, the implants in the teeth. But I was literally telling him also, like, what our goal ultimately is, not to sound morbid about things, but this patient was 52 years old. How do we get you and place our implants to make sure that they're going to last as long as possible? Not just your implants, but also your prosthesis, right? Which is your teeth. And that is a combination of surgically placing your implants, making sure you have enough buccal bone thickness, making sure you're placing your implants in the proper areas so that you're getting proper load distribution, proper sizing of your implants, bone grafting if necessary. All these factors come into account that when we're looking at placing your implants over the long haul, how can we do certain things to make sure that we can get as much time as we can out of your implants, and maybe again, lasting your whole life. Again, we can't promise that because there's certain other factors that come into place. Certain patients may be grinders, clenchers, patients may have softer bone, patients don't have as thick bone or whatever. Certain factors come into play that basically we have to work around, and that's ultimately going to come into the has to be factored in from a surgical perspective. Now, also, there's things that our prosthodontist is going to take into account to make sure that the load distribution is going to be good, making sure that your occlusion is good, making sure that he can take everything into account to make sure that you're going to have a great long-term prognosis, because it's not just all about the implants, it's also about the prosthetic design that can impact how much force that you're going to be getting on those dental implants that could cause more wear and tear, and therefore not the longevity out of those dental implants, right? So these are certain things that, just to letting patients know that we have to take into account to make sure that that patient gets as long as she can out of those dental implants from All-on-4. A person that we had a comment in regards to our wasted $50,000 on dental implants video, someone said, I had this terrible experience. 2-3 years of my life got wasted, but I saved money, learned my lesson, did my research from now on. Thank you, doctor, for educating us through your video. And, that's our goal with all these videos, is to just let you guys know that, hey, I want you guys to understand that we're not just commoditizing dental implants. This isn't like getting a set of shoes or buying a car. There's a lot of nuance that comes into the equation of getting you a new set of beautiful teeth that you can chew with. And again, it's from the surgical perspective and the prosthetic perspective. So hopefully my videos can help you guys with that. Someone left a comment on the implant nightmare video, one woman's dental disaster, but someone said, I have a dumb question or answer, I can't say, I have a dumbass. Oh, sorry. She said, I have a dumbass that's been trying to do my teeth for 15 years and still can't make them right. The same damn teeth breaks. I spent over $65,000 on the damn teeth and it's still not fixed sorry, this is a very disjointed message. I asked, should I now sue these people? They worked on these teeth 15 times. Okay, please give me some help. When you guys make the decision to financially hand over that check or swipe that credit card or sign off on the loan agreement, It's very important that you work with people that know what they're doing, because in the event that you are now stuck later on in the future and things are going sideways, there's very little recourse that you now have at that point. And then you're probably going to be out more money trying to get it fixed. I have a video or a patient that came in for a consultation on Friday. She had her All-on-4 done in 2019, I believe. She told me off camera she spent about $32 to $34,000 for that upper arch. She couldn't afford to do the lower arch, and here we are 6 years later, and she didn't have a warranty, or she wasn't aware she had a warranty, but her implants are failing. I'll have that video coming out later on, but the reason why they're failing is because there was an excess cantilever up top, and honestly, they should have placed longer implants. Let's see here. Next comment. Someone says, Dr. Choi, I really, really hope that you will reply to this, as I have not seen any periodontists mention this. Can bone grafting be done to an existing mobile tooth, possibly class 2, to save it? I had bone and gum loss to it due to gum disease, which is cured now, but the loss is not reversible. I know bone grafting is definitely possible for tooth loss, but must a patient lose a tooth due to bone grafting? Can't due to existing tooth at all? All right, I don't know if these questions are coming from Asia or... Okay, so, you know, these... When you have gum disease, I've talked about it in my bone grafting 101 videos, my dental implants 101 video, part 3. It's a 45-minute video, but I think that video is like really good because it goes into all the little details about bone grafting. And there's different types of defects, whether it's a periodontal, like, you know, you have periodontal disease, gum disease, or you lost a tooth some other way, or even with bone loss related to implants. There's a certain amount of walls around a dental implant, like 1 wall, 2 wall, 3 wall, 4 wall defects. The more walls that you have, like a 4-wall defect, the better, because you have outer edges where that if we add some bone grafting, that defect is well defined, and so you get very predictable bone growth. If you don't know what I'm talking about, and I'm more of a visual guy, I highly recommend you watch that video, because you'll understand certain concepts about it. Now, in regards to this question, patient has periodontal disease or had periodontal disease, and they have bone loss. I'm guessing that this patient has horizontal bone loss, and there's really no way that you can bone graft that. And if anybody tells you that, you know, if you have no walls and you just have horizontal bone graft, horizontal bone loss, and you can get bone grafting on that, just save your money. Sadly, I hate to tell you this, back when I was working as a private, like a independent contractor at some of these offices, like these corporate offices early in my career, especially out in California, and some periodontists might know what I'm talking about, I would see certain treatment plans where patients were being told to get bone grafting on membrane on literally every single tooth when they were getting osseous surgery. And quite honestly, that's like theft. It's not going to work. So you can only graft certain types of defects. And if you are going to get grafting, obviously occlusion is very important. Then they need to make sure that there's no contact on that tooth. And also another thing to keep that tooth from being mobile is you can splint that tooth also by putting like it's like basically like what they call lingual retainers. So teenagers after ortho, they'll put like a wire on the tongue side of their teeth, and that will really help immobilize and keep the teeth from shifting around, but you can do that also. So if you're gonna get bone grafting, then I would highly recommend some sort of appliance like that, and also adjusting your bite so you're not banging on that, because it's not gonna heal properly if it's banging on that. Let's see. So long story short, if you're needing an answer, go get another opinion from a few different opinions from periodontists in your area. Jay Lee said, in regards to my sinus lift 101 lateral versus vertical approach, someone says, I truly agree with xenograft on sinus lifting. Please try Interos bovine. So this guy says, I'm just a lab guy at Glidewell, but he's talking about Interos, right? So, you know, what I wanted to say in that video is that bovine bone grafting like is very different across the board. Let me show you this real quick. I use this as an example. So Straumann's a very great implant company, and they have a xenograft here, which is bovine, and I've actually used it on a patient, and I had to, it was wasted money, because there's different types of cow bone out there, and that like I've used different types of like bovine bone grafts that honestly just not integrate and just were very poor quality. So I'd love to try Interos. Hey, give me a sample and maybe we can try it on a patient. But we got to be really selective of the types of bovine bone grafting that we're using when we're doing sinus lifts. But if you haven't watched that video, I'd recommend you watch it. Bovine bone grafting, I love using it on anterior cases. I used it on that anterior implant I just placed about an hour ago. And also I love using it in sinuses. Let's see here. Next comment. Someone said, I'm the one who got pterygoid implants due to bone loss. So far, I'm very satisfied with the dental work. Great to hear. Pterygoid implants, a great option if you want to avoid sinus lifts, but the reality is that not everybody has great pterygoids. Some people have great pterygoids, good dense bone, a lot of volume of bone back there. Some people have very thin pterygoid plates back there, so they're not as ideal candidates. So same thing with zygomatic implants, right? Some people got really big, thick, cheekbones, and some other people have like thinner cheekbones, and we don't know how great of a candidate you are until we get a 3D scan on you. Do my teeth pro bono, but I only need 2 implants and sinus lift, push up a few millimeters. Hey, so guys, we're gonna come out with a video later on, but there's a guy that has a great story, and that's we'll share that story later on. But we actually gave him a pro bono upper and lower all-on-4 case. So stay tuned for details. We actually did that surgery a month ago, or maybe a few weeks ago. Was it a month ago? About a month ago, yeah. So we'll show you his progress and keep you updated on that. But it's something I'm going to do. I don't know how often I'm going to do it. Quite honestly, Dr. Koo can attest to this also, but doing all-on-4 surgeries, man, like I had one last week that like, our average case is like about 3.5 hours. Like it was crazy. Like it took me 7.5 hours last week. And so it beats up your neck, it'll beat up your back. And so how often we'll be able to do it? Like my goal when I was talking about it like a few months ago was once a month, but it's realistically probably gonna be like once every other month. But stay tuned, leave a comment, follow us on our Instagram. You'll get details about how you can get potentially a pro bono all-on-4. Let's see here. I'm gonna actually try to be more active on the Instagram too, but it just we're so busy and it's can be a drag, making sure your hair is good before you get on camera and all that stuff. But anyways, so there's somebody who's called Dr. Annie Mama. So my implant became infected during one of my appointments before it was completed. She put me on 2 different antibiotics and is having me come back in 2 weeks. But I overheard her saying something about a flipper. She must be talking about flipper or bridge instead of the implant. I have already paid for most of the implant and then paid another $900 that day I was going to get scanned. Just because it gets infected during one of the appointments, does that mean the whole thing is a wash? If not, do I have to pay all over again? All right, so this is a multifaceted question that I want to discuss. So if you're losing bone on an implant, or let's say your implant becomes infected early on, some people just try to throw you on antibiotics, and I don't know, if it's my mouth and we're getting an implant infection like in the first several months, I'd probably say just take it out and start over again. Now, as I mentioned earlier, I feel that the erbium YAG laser from J. Morita is awesome at periimplantitis, so that can also be a solution to fixing it versus just trying to throw antibiotics at the solution, because that's not always going to work for a patient. But this patient is also asking about financially, am I going to be out that money? So everybody's different, right? So you're going to see surgeons that are going to be like, nope, it's just your body healed. So if you want to get another implant, you're just going to have to pay the full amount of an implant. Other people will have warranty policies. So make sure that if you have that question, you're worried about potentially having issues with an implant, ask your dentist or whoever that you're seeing, like, hey, what's your policy in regards to if I was to have a failed implant? Do you have a warranty? What if it starts having bone loss early on? What would your thought process be on that? So and again, in regards to if you should treat an implant that has an infection early on, I really think that depends on where in the mouth we're dealing with. If it's a front tooth, you have a high smile line, and again, you're a female and you're 20s, 30s, 40s, like if things go sideways on an anterior implant, then there can be aesthetic ramifications for you for the rest of your life. I had a patient who I saw recently. She was actually the daughter of one of our patients that had an all-on-4. And this patient is, I think, in like her mid-30s, and she lives up in New York City. She saw us for a consultation recently, and she just had an anterior implant that just aesthetically didn't look good. And she had this place as a late teenager, and she just said that she's hated her smile ever since she had this implant. And that's why it's so critical that whenever we're doing anterior implants, front tooth implants, that it be done properly, because you never want to be that person that, is ashamed or hates her smile, because that is a huge blow to your confidence, right? And why I'm bringing this up is that even if you have very ideal situation, like, and you're getting a front tooth implant and you start having an infection or things start going sideways, what gets affected if you have an infection is your bone. And what determines the aesthetics of your smile is your bone and your gum, because your bone supports your gum. And if your gums don't look right, then your implant overall is not going to look right and your smile is not going to look right. So this is a very broad question, but I just want to let people know that if they have an issue like this, maybe it's also important to get a second opinion in regards to like what your options may be. Do we just treat it with antibiotics? How many months after this implant was placed are we talking about? What do the x-rays look like? What do the 3D scans look like? So this is a very case-by-case type of scenario. So hopefully I can answer a little bit and give you a little bit of guidance on that versus confusing even more. My daughter was born without incisors. She needs a bone graft, but I can't find any doctors I trust. Well, this is after someone who watched my Dental 101 implants, what you need to know about bone grafting. So I can already predict what your daughter looks like, right? So born without incisors, their bone's probably thin in that area. So we're probably talking about lateral incisors, tooth number 7 and 10. Whenever you don't have the permanent teeth there, then typically your bone's going to be thinner there. And if you don't have enough buccal bone thickness when you place those dental implants, then that patient can start experiencing issues over the long haul. And when I'm saying issues over the long haul, we're not talking about 2-3 years. We could be talking about 2-3 years, or we could be talking about 5-10 years later. But long story short, when patients start experiencing some of these issues, it can become extremely problematic. So the best solution is to make sure that that patient has adequate bone thickness by doing guided bone regeneration even before, or if it's very deficient, then you have to do guided bone regeneration, wait 6 months, then place your implants. Or if it's not that deficient, you can add the bone and do the implant at the same time. So again, it's a very case-by-case basis. Now, I'll also tell you in my 14 years, I've also seldomly seen some patients who were born without incisors and they had their primary incisors, lateral incisors, and hey, they just needed very minor bone grafting. So again, those cases are lesser. We see them less often than the other cases, but we can also see those